Okay, so now we will be discussing a very important topic. So it is about your Glasgow coma scale or GCS, right? So here there are three components, right? Eye opening, vocal response, and motor response. So eye opening maximum score is your 4, vocal response is your 5, and motor response is your 6. Okay, so if you just add it, it comes almost 15. So total score of your Glasgow coma scale is your 15. Now there are two questions that can be asked directly from the score itself. That what is the score when you are fully conscious or fully aware? Remember, when you are now watching the video, that means you are fully aware, fully conscious. Your eye response is maximum 4, vocal response is 5, motor response is 6. Okay, so when a person is fully conscious, fully aware, he is okay, normal. So in a normal circumstances, when the person is fully oriented to time, place, and a person, so his GCS score would be 15 out of 15. Okay, GCS score would be 15 out of 15 when he is well oriented to time, place, person. And now GCS in trauma, or if we say that GCS is compromised, when it will say when it is say less than 15. Okay, GCS is compromised, and the least score of GCS is 3 by 15. Okay, so we will now discuss the components of GCS. So I already mentioned that E for eye opening, B for vocal response, and M for motor response, right? And then I will show you how to solve questions if it come from this topic. Okay, let's move. So I will write here only. First I will write about your eye response. Okay, eye opening response. So 4, 3, 2, 1. Correct? Okay. So since your last score is 1, so in eye opening the last score is 1, in vocal response last score is 1, and motor response last score is 1. So minimal GCS score will be out of 15 will be your 3. Now you understood that minimal GCS reading or GCS score out of the total score will be 3, because it cannot be less than 3. Okay, so we will start with eye response. So 4 is for spontaneous eye response. Okay, spontaneous eye response 4. 3 is that eye response is there to verbal command. Okay, verbal command. If you talk about score 2, it is that eye response is present at painful stimulus, and 1 is always for no response. So 1 anywhere is 1 anywhere in either eye opening or vocal or motor response. 1 is no response. Okay, so we will see that again, that eye opening 4 is spontaneous eye opening, 3 is eye opening is there on verbal command, 2 is eye opening is there on painful stimuli, and 1 no response. If we talk about verbal response, so again we will write 5, 4, 3, 2, 1. So 5 is normal oriented, right? Normal oriented conversation or vocal response. 4 is your confused. Okay, 4 is confused, right? And then 3 is inappropriate words. Okay, 2 is your only sounds, 1 is no sound, so you can say no response. Okay, Alright. 5 normal orientation, means normal oriented vocal response. 4 is confused. 3 is inappropriate words. 2 is only sounds, and 1 is no sounds or no response. Now we will talk about the motor response. So again, since there are 6, okay, 6, 5, 4, 3, 2, 1. 6 is simple, obeys command, means motor response is as per your command, right? If you say that move to the right, he will move to the right, or if you say move your leg to the right, he can move his leg to the right. So motor response is as per your command, so obeys command is your 6. 5 is localized to pain, so motor response is localized to pain, okay, means wherever you will give a painful stimulus, the motor response is localized to there only, okay. 4 is withdrawal or flexion, okay. 3 is abnormal flexion. 2 is extension, okay, and 1 again no response. So we'll see this again, okay. Okay. 6 is obeys command. 5 localized to pain. 4 withdraw or flex, okay. 3 is abnormal flexion. 1 second. Yes, 3 is abnormal flexion, 2 is extension, and 1 is no response. So now a question scenario, may be given where it is asked that a person having verbal command, means eye opening on verbal command, or confused vocal response, but obeys command, and that a motor response is present, okay. Then calculate the GCS score. So remember, if such situation is given, you always go with the your preference will be first you will go with the motor command, okay, and then you will go with the highest command of the motor response. Now if they gave 2 motor responses in one question, say the person has this one, I'm giving it red color, say the person in the question has withdrawal or flexion and also localized to pain, then you will choose the highest motor response, right? So I hope you are getting the point. I will write here for you. So how will you give preferences? Always prefer motor commands, okay, first. And number 2, this is too bright, always prefer motor command, okay. This is your first, and second rule is your always prefer the highest response, okay. So with this if you keep these 2 things in mind, you can solve almost all questions that come out from this topic. Simple topic, okay. Still we make mistake from here, so I hope you will not make any mistake. It's simple topic. Just remember that 1 is no response, and rest is you always go from high to low order, okay. And while giving preference, you always give the motor response first preference, and the highest response more preference, okay. Because if 2 responses are given from the same, say 2 responses are given from the motor response, right, you will choose the highest response, right? Okay. We will do a TNT session from this, and rest all these your doubts will be cleared there, okay, when we see a question and we will solve it, right? Okay.